Dr. Swagel, we appreciate you taking the time to be with us today, and I want to make sure that we focus on the oversight aspect of this, but I want to touch on what has been discussed a lot today, and it's the ACA, and it's healthcare. And I think something that we haven't discussed would be the issue of consolidation in the healthcare space, and I think that creates a lot of issues when we see a hospital be the purchaser of an insurance company or a pharmacy or a physician group or vice versa, and any of the other things. And when I look at healthcare generally, what I see is it's a group of everyone in the industry sitting around a table wanting their own piece of the pie. And let's be honest, they're all handcuffed by the Affordable Care Act and the limits that put on competition. But the sad thing to me, and I think it's something that my colleagues across the aisle fail to recognize, is that the only people that aren't getting a piece of the pie are the American people. They're the ones getting left out, so that this hospital system or whoever that also owns an insurance company, that also owns a physician group, that also owns a PBM, they have no incentive to lower the cost of anything because each of them profits along the way. And so I think it's the consolidation that has become the issue. And I'd like to introduce into the record this testimony from the Director of Health Analysis from the CBO. And I want to highlight something that was said.
That objection, so ordered.
Thank you, Chairman. This is a direct quote from this. The CBO projects that federal subsidies for private health insurance will total $6.4 trillion through 2033. And that is a staggering number to me, which if we have to subsidize this to make it work, it doesn't work. And so my question for you would be, can you explain why the CBO's initial scoring of the Affordable Care Act was incorrect?
Okay. No, very good. I'm going to answer that directly, and then maybe I'll just say a word or two about the consolidation and vertical integration, which are really at the heart of some of the analysis. So the Affordable Care Act, had many pieces to it, and one of the challenges for CBO is that there are things that were done that were new or the evidence base was narrow. And so, for example, the mandate that had been done in the Commonwealth of Massachusetts, but it turns out that what happened in Massachusetts doesn't really, in retrospect, didn't shed as much light on what would happen for the whole country. So that, in terms of the uptake in the exchanges, was much less than CBO at the time expected, whereas the uptake in Medicaid, the Medicaid expansion, was much more. And so that's just one example. It's really the challenge is something so new and so big that the agency is going to do the best it can, and then just try to go back and just be honest about it. That like the mandate, CBO has put out other information saying, look, it was just different. I was about to say we got it wrong. It would be another way of saying it, but it was different than what we thought, and here's why. And the chairman said continuous improvement, and that's it. I mean, we've got to do that. Maybe 10 seconds on consolidation and market power, and those are incredibly important questions. It's Chapin White in the testimony talked about that. The vertical integration showed up. We have work on the 340B drug program. The integration you mentioned shows up there. It just shows up everywhere, and we're doing more work on it. But you've got your finger on exactly the key issue.
Gotcha. Well, Mr. Chairman, I do have some questions about transparency I would have liked to have gotten to, so I'll submit those for the record, but yield back.